We've heard the statistics. Americans are addicted to sugar, but the question is how much? Joining us today to explain the problem and how we can change our behaviors is GBMC's Dr. Elizabeth Dovec. Good morning.
Good morning. Thank you for having me.
Of course. Now, when we talk about sugar, how much do typical Americans consume?
A typical American in 2019 consumes 73 grams of sugar a day.
Wow.
If we look back at in the 1700s, it was less than 1 gram a day. So now we are at 73 times that. And 25% of Americans are consuming over 150 grams of sugar every single day of their lives.
And I'm sure sometimes not even realizing it, right?
Absolutely. Sugar is hidden in everything. You think it might be just adding sugar to maybe your coffee or something, but it's more than that. It's hidden in ketchup. It's hidden in sauces. It's in things that you know, like ice cream, in chips, in breads, in pastas. Sugar is everywhere.
Right. So what do we do?
Well, it's hard, and there's a lot of things you can do to still get that craving for your sweet tooth, but also to help you with your health. I think the best substitute is things like berries. Fruit is great. It has natural sugars in it, so you still satisfy it. But then there's also, if you want a dessert, I would stick for ones that are higher in fat. Even something like cheesecake in moderation is much better than doing something that's pure sugar, like ice cream.
Huh, okay. All right, so if we want to lose weight, how much should we consume each day?
So we should have no more than 15 grams of added sugar every day. And like I said, the average American is consuming 73, so that can be hard. But sugars, like I said, are hidden in everywhere. So what we suggest is that patients or people in general look at labels to see how much added sugar in there. And then the new food label, it actually states what is the added sugar amount to the food.
And I guess it's helpful now, even with restaurants doing it and things like that. You know, you're able to really calculate it. How do you break the sugar addiction?
It's hard, and I think the most important thing to do is to actually eat more. I think most people try every day they wake up and they say, today's the day. And they don't eat breakfast, and then they don't eat lunch, and then they eat very little for dinner. But at some point, that's going to catch up to you. And you're going to find yourself with that feeling, I just need a little something, because your body needs fuel to keep going. It needs glucose. And you'll find yourself in your pantry, in your freezer, or wherever, and you're going to start to consume sugar. Because it's the quickest way to get that feeling to go away. So I think people, to lose weight, you need to eat more. You need to eat 3 meals a day. You need to try to stop picking and snacking and grazing. And you also need to focus on high protein. Protein is a great way to fuel your body, but it's also not as dangerous as sugar.
And of course, you know, when we think protein, we think, oh, okay, the chicken, you know, poultry or meat or something like that. But, and as you said, you can have a little bit here and there. So in moderation, it's all about the balance at that point.
It is, but sometimes I think there's certain foods that you have to realize are your heroin. And sometimes it's hard to do heroin in moderation. Or impossible, really. If I always say, you know, I'm a recovering cherry Coke addict. I used to drink upwards of 2 liters of cherry Coke every day. And one day I realized this is not worth ruining my life over or impacting my health, and I know I can't drink cherry Coke anymore. And I'm not saying you need to be punished, but sometimes you just need to know what the thing is that really is very addictive to you.
Right. All right, how can we get more information about the GBMC's Weight Loss Center?
So the best way and the easiest way is just to go to our website. Our website is gbmc.org/weight loss. When you're there, you can sign up for an information session. We do them online. You can do them 24/7. We'll call you and we'll get you started for an appointment to meet with our comprehensive staff.
Very good. Thank you so much for joining us.
Thank you for having me.
Sure thing.
Well, we hope you're